كل واحد على مكانه. Shall we start? Here in this photograph we can see irregular tortuous vessels. This one is called arteriovenous malformation. This is commonly seen in 10 to 30-year-old person or patient. This one is easy to bruise and then to lead to hemorrhage. Okay? Commonly misdiagnosed as a mass because it's collection tortuous vessels. Here is another picture of vascular malformation, but here is irregular and very extensive, involving the brainstem. This, if it is bleeding, it will lead to cerebral hemisphere hemorrhage. Most commonly affected, males. Here we have intraventricular hemorrhage. Why? Because of the bleeding of the rupture of the vascular malformation. If it is rupturing inside the ventricle, it will lead to intraventricular hemorrhage, or could be subarachnoid space hemorrhage. Under the microscope, how we can identify vascular malformation? We can see dilated blood vessels or tortuous or worm-like blood vessels. This is, as we said, it's easy to bleed, and then the bleeding will go either in the intraventricular or into the subarachnoid space. Either way, it will lead to seizure disorder. Another picture of vascular malformation, but here we have a small blood vessel, not only the largest one. Again, it is called vascular malformation. This picture we can see extensive hemorrhage in the frontal lobe and in the parietal lobe. This is consisting with a falling backward. Then the brain will go countercurve to the front injury. So the injury will be mainly in the frontal and maybe the temporal lobe also. This is most commonly seen in elderly people, that they are falling backward most of the time in the bathroom. Grossly, we have inferior gyral contusion here. Again, this is characteristic of the previous one, falling backward, and then the brain will go countercurve injury to the frontal. This not only seen in falling backward in the bathroom, it also can be seen in car accident. Here again, we have a hemorrhage, but this one is orange to brown like scalloping appearance in the frontal lobe. Why we have the orange to brown appearance here? Because this is a resolving of the hemorrhage. It's the remaining hemosiderin after the hemorrhage has been occurred. So the brain tried to encounter or taking all the hemorrhage, but remaining is the hemosiderin. Again, the same picture. There's a contusion in the frontal lobe for the, it's due to traumatic force. Here we can see a massive or extensive hemorrhage in the inferior and in the upper part of the brain. Again, this is due to a vehicle accident or a car accident, contusion and laceration. Last week you have learned the diurete hemorrhage of the pons. This is the pons, and this is called the diurete hemorrhage. Diurete hemorrhage is due to compression or stretching or ischemia of the perforating arterioles. So the compression could be due to various reasons. It could be due to hemorrhage, could be due to edema or mass lesion. Here, extensive white matter petechial hemorrhage seen this one. This one is due to fat embolism syndrome. When we can suspect this one, if the patient is having an injury like falling or a car accident 1 week before the presentation, then we can suspect the fat embolism syndrome. because the fat is going to emboli from the bone into the brain and causing this ischemia. So the patient will be presenting with the neurological signs and symptoms. Now shifting to the infection. Here we can see exudate fluid that is obscuring the sulci. Why we say exudate? Because it's not a purulent. It's whitish, not whitish, it's yellow. So we are suspecting acute bacterial meningitis. Why we say bacterial rather than viral? Because bacterial can lead to exudate, which will be rich in neutrophils and what? Proteins. It will be rich in proteins. That's why it's called exudate. So bacteria can cause this, but viral, what will cause? It will cause mononuclear cells or lymphocytes rather than the neutrophils, and the fluid will be clear. Again, this is cause of acute meningitis. This tan green exudate seen here in the brain. Same picture, previous one. This one, example of acute bacterial meningitis. If we suspect the patient is having acute bacterial meningitis, we should do the cerebrospinal fluid through the lumbar puncture. Then we'll see if there is a high glucose or a low glucose, high protein or a low protein. And we should see if there is a neutrophils or a mononuclear cells. Then we should do the gram stain to identify which organism is this. Under the microscope, how we can see this one, a neutrophilic exudate or a collection of neutrophils or abscess formation. And here is a dilated of a blood vessel. This is a case of acute bacterial meningitis. This one, obviously we have a shifting of the midline to the other side, and we have this one, intraventricular hemorrhage and some ischemia. And what is also here is the greenish color seen here. This one we are suspecting that the patient is immunocompromised. Why? Because this is typical for fungal infection. Fungal infection most commonly is aspergillus. And this green color is due to the bile going to the brain through the destroyed blood-brain barrier. This is the aspergillus under the microscope. It's a hyphae, and typically for aspergillus, they are destroying the blood vessel wall, either to cause a hemorrhage or to cause a thrombosis. Okay? This is a viral infection. Why we say it's a viral? Because these are all mononuclear cells around the blood vessels. Okay, so we are suspecting that this is a viral. If it is including the cortex, it will be called encephalitis. If it is including the meninges also, it will be called meningoencephalitis. Most common viral can cause this is rabies. Here, this one, we have small petechial hemorrhage in the white matter and in the gray. This one is not commonly seen, but this is a herpes simplex virus encephalitis. As we can say previously, again, it will cause a mononuclear cells infiltration rather than the neutrophils. And it is seen also in non-immunocompromised person, not like the aspergillus. This one is cerebral abscess. Why? Because we have a liquefactive necrosis or pus collection surrounded by a thin wall. This is due to hematogenous spread of a bacterial infection into the brain. How we can see the abscess? Again, this is an organizing abscess under the microscope. This is the normal brain tissue, and this one is a connective tissue. While it's like a blue color, it is due to trichrome staining, special stain. This is an organizing abscess. This picture showed markedly dilated cerebral ventricles. This is called a hydrocephalus. Why we have it? Because if we have a lack of absorption or destruction of the outflow of the cerebrospinal fluid, it will be accumulated inside the brain. So this picture could be seen as a complication of acute bacterial or acute meningitis in all. This picture shows this one, the spongiform encephalopathy. This one, the halos that you are seeing here, it is characteristic for Jacob-Creutzfeldt disease, which is a rapidly progressive dementia. Again, area of granularity in the white matter. This is for a demyelinating disease, specifically for progressive multifocal leukoencephalopathy or PML. Same, PML under the microscope. Here we can see the enlarged dark pink ground glass appearance or nuclei that is containing the viral antigen. This one. This is the nuclear body inclusion, cytoplasmic eosinophilic inclusion seen. This is characteristic seen in rabies virus. Here we are seeing a neurophagia. Why? Because this is the dying neuron and it is surrounded by the microglial cells. This is called a neurophagia. Any question? Thank you.